And welcome again to our show. We're continuing our series with Dr. Stanford Owen with the Center for Health Management, talking about diabetes and how the product PrescriptFit can help you and deal with this. So let's start out first talking about, I guess you would call the basics, if you would, Doc.
All right. Well, like I say, every segment, the three things that cause diabetes: food, food, and food. So if we're going to treat type 2 diabetes and treat it with nutrition therapy, we have to manage the food. The first basics is we have to get sugary drinks out of the life. They're probably the #1 cause of diabetes in the world, and basically soda, juice, milk, sweet tea. Sport drinks recently have been identified as a big contributor, especially in kids. So sugary drinks go first. They need to be permanently out of the life. Diet drinks are fine, so patients can drink all the diet drinks that they want. Secondly, we have to add foods into the diabetic diet that are both healing and non-toxic. And that's basically, the healing foods are
good nutritional foods.
The PrescriptFit, which is perfect food for a diabetic. It basically normalizes blood sugar, normalizes metabolism quickly, and then adding the 8 basic food groups that are non-toxic to diabetics. So seafood, poultry, non-starchy vegetables, eggs, nuts of any type, and whole fruit. And then high-protein snack bars. These are non-toxic, so we add these into the environment in large amounts if necessary. And then thirdly, we want to manage the toxic foods, and that's basically the really scrumptious pork, beef, dairy, especially those combined.
All the stuff we Southerners love to eat.
That's it. Everybody loves to eat, especially when you combine those fats with starches: wheat, corn, rice, potatoes. That is the cause of type 2 diabetes. So it has to be managed, and the key word is manage, not avoid, because we can't avoid these permanently.
What about breads? We love to eat breads, biscuits, and all that.
Wheat, corn, rice, potatoes. So what's bread made of? Wheat, pasta, right. Cereal, cake, snacks, and so forth and so on.
And a lot of people think, oh, I'll just eat wheat bread.
Whole wheat, brown rice, that's marketing gimmicks. Wheat's wheat. If you crack it, whole wheat, it'll crack your teeth. I used to harvest wheat.
Really?
Yeah, that's a marketing gimmick.
Let's talk about now the science and logic behind this.
Most people think that diabetics need to lose weight to control the diabetes. They really don't. Now, most diabetics using our program will lose weight, but it's not essential. And the reason is the portion control is unimportant. The most important thing is these non-toxic foods are eaten liberally, that the patient feels full. Diabetics are hungry. The lack of insulin working in the brain makes them hungry, and they have to fill up. So if you fill up with these non-toxic foods, they do just fine. Taste is paramount, and again, my opinion is diabetics have better taste than the average person. They like these really high-fat foods, and so whatever we replace these foods with on a daily basis have to really taste good. They have to feel full. One of the reasons we put our high-protein foods up front is protein is very filling or satiating. So one of our strategies is we add these in first while the patient's healing, before we add the really toxic food. And then finally, they have to have choice. These are all the food groups that are on the planet, so there's no food groups that are off the table indefinitely. And that's extremely important because it allows them to be socially inclusive. And the reason I added these one at a time is to have the individual be able to anticipate something coming up. So if I'm going to deprive myself today, I have to anticipate something good tomorrow.
Right.
And everybody's different. We normally recommend that patients start with PrescriptFit only because that normalizes metabolism, gets the sugar down, gets the medications down, gets them feeling good. And then we add a food group every 3, 7, or 14 days. Of course, the longer they go in each phase, the more rapidly they improve, and the more rapidly they heal, the more rapidly they get off medication. But some people don't have that tolerance. So 3 days, some patients start off, I'm going to do 3 days, and they go 1 day and they can't take it anymore. Bam, they go to the next phase.
It is hard. I mean, it is hard at the very beginning of it. It's, I don't like to use the word diet, as it is a lifestyle change.
Strategy.
Strategy.
Strategy is the word we're looking for.
And to do this, I mean, if you really set your mind to something like this, in the long run, you're going to benefit tremendously for it.
Sure.
And help your health.
All of us are immediate gratification animals. We want to see and feel results immediately. So that's what this is designed to do. So in 3 days, they can sense how much better they feel. Their energy is improved, their breathlessness is improved, their blood sugars are coming down. and then we add a food group one at a time. They can experience if this food group is having an adverse effect on how they feel and how their blood sugar is doing. So it's the anticipation that's really, really important. Now, some patients can't avoid anything. They say, I cannot avoid any food, period. No big deal. So we have them start out in phase 8. They're eating all of these foods from the get-go. We're just using PrescriptFit to do the healing. And then we add the splurge groups shortly thereafter once their blood sugar is improved.
So you're not totally cutting out this.
No.
This is what you consider a splurge meal.
Splurge. Splurging is a good thing. We want to splurge. We just got finished with Thanksgiving. We got Christmas coming up. You may have a vacation. You may be going on a cruise. No big deal. All we do is anticipate that, work this into the schedule, and it's not going to really knock the diabetes down. Now, in the back of all of our brains, we all are thinking, well, I'm going to die anyhow. We each get 80 years plus or minus 10. Sorry about the truth, but that's a fact. Diabetics generally get less than that. So my goal is to help them get their full 80 years and a really high quality of life with the fewest medications possible. And it's really this easy. It's this simple. So most of our diabetics...
Discipline.
It's strategy. Okay, I keep using that word strategy, and everybody's strategy is a little bit different than the next person's. You may have a spouse that's difficult. You may have a kid environment that's difficult. You may have a work environment that's difficult. You may have physical impairments that keep you from exercising. So everybody's strategy is going to be a little bit different than the next one. However, there are still only these 12 basic food groups. And so once you figure out how you're going to use these food groups in your strategy, and you see your blood sugar controlled, we literally measure how much better you feel with fatigue and breathlessness and heartburn and joint pain, and experience that and realize the foods are making you feel bad, it tends to push you back to the foods that make you feel better. And that's the fundamental core about how the strategy works.
So we got about a minute left. So, we started this series off here a few weeks ago regarding, for diabetes, how to deal with it, and how to live with it, and how to fight it. And with a lot of through the diet.
And this strategy is for the spouse as well as the person with the diabetes, because the spouse is involved as well. So maybe the spouse is the person who does the shopping. Maybe the spouse is the person who does the cooking. So the spouse needs to know and understand the strategy as much as the patient themselves, sometimes even more. Mm-hmm. Diabetics don't think clearly, especially when the blood sugar is not controlled. So this allows them to control their brain chemistry and get things improved.
Okay, if you want more information, website is on your screen, or also you can call the number on your screen if you'd like to set up an appointment and get yourself on the road to recovery from diabetes.